Hey everybody, this is producer Eric. So, Karin wanted me to let you guys know something. Before you take any of the advice she offers on the show, please speak to your medical doctor. Also, when you do take Karin's advice, please understand that results will vary per person. Alright, let's start the show.
Hello, everybody. Welcome to Shit Isn't a Dirty Word podcast, hosted by our very lovely Karin Namani. Hi, Karin.
Hi,
How are
Larry.
you?
How are you?
Hi.
Hi, Eric.
Hey, how's it going?
Everything is wonderful, like always.
Awesome.
Excellent.
Glad to hear it.
Even and just as a side note, because I think we're going to get into this with the episode today and our awesome guest. But everything has, even when it's not wonderful, I think you have to have that attitude. It's wonderful, and you got to smile through it, right? You got to make it wonderful.
Oh, yes.
Exactly.
We
You,
have to make it happen.
you got to,
Wonderful. Are
because
you kidding? Sun is going up, sun is going down, new day. It's always going to be a wonderful day, even if it's not.
yeah.
Just should happen.
Yeah. Yes, it does. Yes, it does. So, Karin, would you like to introduce our guest for this
We'd love.
episode?
Oh, yeah. We'd love. So I want to introduce. First of all, she's one of my best friends. I know her for 22 years almost. We started kind of together teaching massage back then. That's how we met. She was one of the instructor. She's amazing, loving person, but this is as a friend. And now as a professional, she's one of the best acupuncturists in town, specialize in fertility and the gut and the digestive system. But this is her specialty. Even though she does everything, she treats cancer, she treats muscle, she treats every single thing, and she brings more than just acupuncture. She brings lifetime. She brings all her, you know, massage and energy, and she's good at what she does. And she's tougher than me, meaning she's more stubborn when it comes to treat people. So I welcome you, Sharon, Dr. Sharon. Actually, she earned it.
Yeah.
She did. So welcome, Sharon. She's specialized in all those subjects, and we're gonna do all the connections
Thank
and
you,
learn more
Karin.
about it. So welcome, Sharon.
It's wonderful to be here. Beautiful sunny day in California, and wonderful to see you, my friend, and everybody else.
Awesome.
Yes, yes. Thank you for coming on the show. Before we start, before we record the show, we talk a lot sometimes. And you have can we call you Dr. Sharon?
Sure.
Okay,
Yes.
perfect. You have a great a great history that you were starting to share with us. And being an acupuncturist, is that your title? Is acupuncturist right, or is it a holistic? What is it? What is the title for you?
Yes, acupuncturist is right. Licensed acupuncturist. That's basically the title.
Okay.
In California, we are very lucky to be primary care providers,
Oh,
which means that we don't have to be referred to as a doctor, and we can just treat people, and it's wonderful.
very cool. I didn't know that. That's really great.
See,
Hmm.
That's really great. Tell us a little bit about your history, and how you got started, if you don't mind.
Definitely. So I was just starting to tell you guys that I was a medic in the army in Israel, and I thought that I will proceed to start my education as a doctor. But a lot of the Western doctors that I worked with during my service were expressing that they're not very happy with their work, that they're doing a lot more paperwork and caring about what insurance companies are telling them to do instead of truly just caring for their patients. And they're seeing their patients for a very limited amount of time, and they don't feel that they're giving the kind of level of care that they thought they would when they were going through the very long education. So it kind of encouraged me to pursue a more holistic approach. And I started my education as a massage therapist in Israel. And then I moved out to LA after finishing my service. And that's when I met Karin, and I was teaching massage therapy, anatomy, physiology, and many, many different modalities of massage for many years. And then I've kind of, stumbled upon acupuncture, even though we kind of learn about it. I went a little bit deeper into it and realized how amazing what it can do to the body and to all the different organs in the body, all the systems, and decided to go back to school in my 30s while having my little one. And that was a great experience. And I'm very happy that I did it.
That's cool.
We're happy too.
That's very cool. That's very cool. So okay, so I gotta talk about this, because how did you and Karin meet? Because like, we're working with Karin, and I get like all this great knowledge of how Karin got started, and I gotta tell you, it's almost like a rock star, right? Because she comes to LA, and it really is like a fairy tale almost, because Karin, you come to LA and you don't know anybody. You open up your business.
I think Sharon was the first one I knew when I came.
Wow.
I mean, in the field, because I came to run the massage school and teach, and she was the teacher that showed me the school because she taught in a different one.
That's cool.
And that's how, I mean, I don't think we left each other since then, but I didn't open my business right away. It took me about 2 years to open my own business, but I was there all the time. I mean, teaching 3 times a day, every subject there is.
Yeah. Yeah. Yeah.
But again, you have to understand, back then, even though I did colonics wasn't big. I mean, no one was really open. I mean, as we talk today, colonic is not that much open. So back then it was
Right.
like just hilly-billies. So yeah, when I did open, you can say a Cinderella fairy tale. It was a hard work,
Right.
but you know,
Yeah.
I
Yeah.
built up the clientele to get me to what I am today, of course, with all my knowledge. But I did came with as a naturopathic doctor, so that gave me a little bit more. But again, like Sharon mentioned before, today acupuncturists are part of the medical field.
Yeah.
Before, it wasn't. I mean, that everything happened in transition. I mean, to recognize what we do. Massage was never as part of any plan, and suddenly chiropractor started to use it as a physical therapy. But no insurance would cover massage today. I think, I don't know, maybe I'm wrong, but today massage is inside that. I know in Israel it's inside, as well as acupuncture, as well as other treatments. But yeah, that's how we kind of started. Yeah, I mean, it took Sharon. I mean, Sharon did what I did a little bit earlier than 30, but yeah, I'm older than her.
Oh, yeah. Yeah, I started teaching right after my Army service finished. So I started teaching at 20
I
and
started at
taught
20.
until 30. Yeah.
Wow.
So yeah, so
Wow.
I finished my bachelor degree when I was 25. So we just did it reverse. Kind of. But it's amazing, as much as I mean, I don't see ourselves like very different, because we both treat the same thing. Because as I mentioned before, everything starts in the same organism, in the colon. And also, and Sharon will give us a big take about it, because everything starts in the colon, in the digestive system. And by collaborating those two together, a lot of time I will send to acupuncturist, especially after I clean, and she will send me people to clean them out so she can actually
Mm.
move forward
Oh.
with her treatment. And I mean, Socrates said that long time ago, everything start and end up in the colon. So whatever we will do at the end, we'll start there.
Yeah.
So I don't want to waste time, and I really want Sharon to give us a lot of intake about what she does, because so many people can benefit, like yourself. You didn't know that insurance cover acupuncture, and yeah, there is a lot of insurances that do cover, and so many people can use acupuncture in their everyday life, you know.
Yeah.
And I think they can benefit from it so much. And like we always say, there is some simple problem that we can take care, and it's not a big deal before
Yeah.
it become a big deal, of course.
Definitely. You know,
Yeah.
acupuncture was created originally to be a preventative medicine. It wasn't created to fix issues. So
Really?
the origin of, you know, acupuncture in general from 5,000 years ago is to make sure that everybody stays healthy. Of course, there are procedures to help people in cases of emergency since they didn't have Western medicine back then. So even in the original scriptures, they have, you know, what to do if someone is having even a heart attack. So it was there in place, but it was meant to be done on a regular basis to prevent and to kind of keep you in balance, not only your physical body, but also your energy, your emotions, reduction of stress, everything. So that was the origin of it. Now, you know, I would say 80% of my patients are coming in for specific issues, but I do have the 20% that get it, that have been getting it for many, many years on a regular basis. And we rarely treat them for any issue that might come up, like a common cold or some kind of
Wow.
allergy, because all of the time, you know, they're feeling wonderful because they're getting it on a regular basis, that they're staying balanced. And what's unique about it, the fact that it's so holistic, is that nutrition is a big part of it. It's actually part of the first questions that I ask. It's not, I don't even ask them what their diet is as much as, how does your poop look? When do you even look at it? And you'll be surprised the amount of people that don't even check their poop. They don't know how it looks. And then I say, okay, for your next appointment, that's your first homework. I need you to actually look after your poop and describe, you know, just describe it to me, because that will tell me how their digestion system is doing, what they're eating. I will know by the way they describe their bowel movements, what they're
And the
eating, how's their
colors and the
diet.
shape.
Exactly.
Wow. Wow.
So,
Larry,
and
you
then
shouldn't be surprised because you didn't know you need to look at your shit before.
Oh, well, I was gonna say, well, that's great, because if they don't really know about, you know, to look at their poop or even what their poop means, I have a person maybe on the other end of the microphone that could have a poop chart that's available.
That's available in a website, and it gives you all the shape, colors, smells, everything, because it's it's a system. The way it looks the same way, it feels the same way, it smells, that indicates so much. It's like a whole map. And like in acupuncture, there is channels that tells you exactly what happened in each one and in each point, and what one thing affect the other. But again, if, like Sharon mentioned before, if your poop or digestion doesn't look right, how are you going to know which system to treat? Because you can't treat all system in one time. You want to do one by one, the same way I will do when I release toxins or when I release old stuff, I will go one by one of what needed. Because if I'm going to treat everything in once, most likely I'm not going to get the results I want. And most likely the
Definitely.
person is not going to follow up. So we have to also think about the people that should follow any type of diet or any type of treatment, because if it's not going to be something that is going to be relayed to them and they're going to understand the importance of it, they're not going to do it. They will suffer. They're not going to do it. There is idiots in this world. They will suffer.
I don't consider them idiots. I consider them how open they are to change. Some people are very stuck in the way that they are, and they feel that change is too hard for them, or
Yeah.
they'll find 10,000 excuses of why not to do what we offer them as information. And that's why it's important to give them the option, and give them to the level, and we kind of spoke about that before, to the level of what they're open to do right now. So
Right.
I always say, no diet is right for everyone. It's very specific. When I give a list of foods to people, let's say they suffer from heat, and then their poop smells stronger, and it can even smell spicy, and that is indication of heat inside of their body.
Wow.
So I give them a list of cooling foods. It's foods that they eat all the time. They just didn't know that they cool off their body from the inside. So I say, try to combine some of these foods into your regular diet. That way they're not, oh, I have this whole list of stuff that I have to do, and they're worried about
Right.
not being able to, stick to it.
Yeah.
So it's all about the little changes that change in the long run
Yeah.
tremendously how they feel.
Yeah.
I know I say idiot before. I didn't mean to hurt anybody, but saying idiot, no. I'm sticking behind my word. Saying idiot is those people that know they have problem.
Yeah.
Now we can't help someone that doesn't want to help himself, period. It's not going to happen. And that's why I said specifically idiot, because those people will come only when there is no other choice or no other way. And that's when we as a therapist get in a hard time to treat them.
Yeah.
Because it's either already impossible, or they're so stuck, or the problem is already too big to even be treated. And that's why I'm saying like idiot. They got a lot of signs before.
Yeah.
So it's not even about stubborn. It's about letting everything happen the way it is, or it's in God's hands, or it's in the world's hand. And I'm saying like, don't wait till we will be the last choice.
Yeah.
That's why we call it prevention. You want to check yourself, you want to treat yourself, you want to make sure all your organs work, in synergy, at least work in some form of balance. I'm not saying everything will be balanced, but in some form. So we mentioned before, like in a few episodes backward, sometimes a person will go to Sharon because they have back pain, or they will come to me because they have back pain. We both gonna look at the digestive system, and we're gonna find out it's not even muscles. It's shit. Sometimes it will be muscles, and then she will work all over the muscles and all over the channels. But that's why the acupuncturist will give you a better even solution to so many things. Correct me if I'm wrong, Sharon.
Absolutely. You know how many times I treat people's back? They come for back pain, and then while I'm needling, even though I'm needling through the muscles that are bothering them, or if it's a spinal issue, a lot of the times I needle points that go to specific organs, and you can feel their reaction, and you can see even in the tightest areas where they have crazy amount of tension, I put a needle and it's fine. Then I go to a point that is organ point, and I do it, and then when I do the stomach point, oh, they jump. I do the small intestine point, oh, they jump. I do the large intestine point, then the whole body is spasming, And I say, you know, it's great that we're treating your muscles and you're going to feel the pain go away pretty fast because that's an easy fix. But I can feel by the points that I'm needling you that you have a digestive issue. And the next time you're coming in, we're flipping you over and we're doing over your stomach.
Wow.
That brings it to the next question, Sharon, for all our audience. What is acupuncture? What we should experience in a session when someone comes to you? Let's say they're kind of healthy, you know, they don't have really specific issues, but they want to try acupuncture.
So
What they
basically,
should expect.
when they come in the first time, I take 90 minutes to really talk to them for about 45 minutes about every different organ system in their body. And a lot of the symptoms that they feel, it could be something minor. Usually they kind of indicate different things that are going on in the body. Some systems can be deficient, meaning that they need more energy to work, or there is a lack of fluids or a lack of blood in the body. And sometimes there are excesses in the body. Either something is stuck, like they have something like chi stagnation, the energy is not moving properly, that usually causes pain. Or they have excessive heat or excessive cold. It could be different things that all the symptoms, all the questions that I ask them will indicate to me that's what's going on in the body. So usually after I do that, I kind of talk to them also to realize which is the most important for them to treat first. Like you said, we can't overwhelm the body and try to fix everything in one shot, because then even the nervous system is going to be confused if I put too many needles in two different systems. The body will say, "Oh, I don't know what you want me to do." So basically, we kind of have to say, "Okay, this is the priority. This is what I feel that I want to fix first," and we focus more on that. But I still do a lot of points to balance the body in general. If you just treat the symptom and not balance the body, you're basically doing Western medicine. You want to make sure that the body is, first of all, open. So that's the beginning of the treatment. I do several points to open up the body to say, hey, I'm about to tell you what I need you to do, and I need you to listen to me. So those are the first, let's say, 4 points that I put needles into. And then I kind of, in a way, speak to the body and say, you know, the points that I do have different things that they do. And the channels have relationships, partners, yin and yang partners, control points to different organs. So I choose the amount of points or needles that will be the most beneficial to what I want the body to do.
And another question, probably everybody, does it hurt?
Sometimes it does. I'll be totally honest. Sometimes it
I
does.
know the questions because that's what, you know, those are the regular questions. So for all
Yes.
our audience, is
Yes.
acupuncture hurt?
All right. So the needles are extremely thin. They're like a hair. So basically, most of the people don't feel where when I put in the needle, and a lot of the times I'll also kind of push on the point a little bit with my hand to desensitize the area, and then put the needle in case they're more sensitive. However, if there is an area that has a lot of excess, you will feel it when I put the needle in for that 1 second that the needle goes through, because almost like the energy is stuck in that area.
Wow.
And the moment the needle goes in, it releases it. So you almost feel the release part of it. And sometimes people tell me throughout, and depending on how intuitive they are, they will tell me, oh, I feel movement in my body, or you did this point here, but I felt it in a different area. So, and it's exactly where the channel is traveling, the same pattern. So it's really interesting to see how people will be either more in tune with their body and feel it. Sometimes they don't, but regardless, they float after and they feel wonderful.
Another question. can I go back to whatever I do that day after I see you?
Ooh.
Well, it depends. It depends what kind of treatment we've done. So we were talking about sometimes people come in just, to relax, for de-stressing, and they want to kind of continue. They go back to work. Absolutely, you can. But a lot of the times the treatments do drain certain excesses that we have in the body, or there is a serious internal organ issue. So the treatment will feel either you'll feel weak after or tired after. So you do want to rest after those kind of treatments. It really depends. Sometimes I do an invigorating treatment. So the person comes out with all this energy after and all this focus. So it really depends on how you react to the treatment after.
Like I mentioned before, you're specialized in fertility. That's what you really wanted to go to school for, because that's your passion. How acupuncture, and this is for all the women, because I help a lot of women by cleaning their gut, and that helps fertility. And I know it as a fact because I have a lot of success stories. But how acupuncture is so beneficial for fertility problem, or girls that wants to get pregnant and they're having trouble. How effective is the treatment? Because I know there is a lot of successful stories of your behalf. So
Absolutely. So basically, acupuncture is doing exactly what I described before. It doesn't matter what issue it is, it's balancing the body, it's bringing it to the best body it could be. So a lot of the times, you'll be surprised. I would say 60%, if not 70%, of the women that are coming to see me have no issue. They are perfectly healthy. There's no reason in the world that they're not getting pregnant. The main issue is just stress. They're so worried about the process. They're so worried that they didn't get pregnant the first time they tried, that it creates so much stress, and they're so in their head that I need to just relax them. So I would say that 70% of the women that come in, they get pregnant within the first 2 months, just because they calmed down. Exactly. So they
now,
calm down and they get pregnant right away, and they're in shock because they didn't expect it to work that fast.
Wow.
ask,
Exactly.
let me ask you that. Now, if they do have a problem, of course, minor, I don't want to say minor problem, but that they went to all fertility doctors. Because if you read my book, that was part of my problem personally. And I did 5 insemination, and I did if you would tell me to walk on my head, I would do that too. No, in some point, and I did acupuncture, and in some point, I just went back to basic, because, like Sharon said, everything was perfectly fine with me. I wasn't even in a stress. It was just like something that dragged me in, like a process, because my husband didn't want to go through everything. And I was like, you know what, go to basic, clean your colon, clean all the shit, all the hormones, everything. And I think mentality, but again, I didn't had a medical problem. Mentality, I was free, and I was pregnant while I was buying my medication for IVF. Well, that was my luck. But if someone really have a problem to create an egg or some blockage somewhere,
Mhm.
acupuncture can help.
Absolutely. So I have, for example, a 43-year-old patient that's trying to get pregnant with her second baby, and she just went to get her egg count checked, and just to look at, and they said, "Oh my God, you have a 20-year-old ovaries," basically, because she's been getting acupuncture for 6 months, and the body is just so healthy and so clean that it's just living its best life. So her body is making more eggs than she even had in the past. And she already did IVF for her first son before we met. So she knew how her eggs looked before, and she would have maybe one maturing egg and very few. And now she, the last time she went, she had over 20 eggs, 2 are really perfect. So now she's ready to go through insemination, like Karin said. And we do work alongside with OBGYNs and specialists in kind of making sure that whatever it's necessary for them to get pregnant. If they're older, I never say no, stick only to acupuncture, because when you're older, you don't have a lot of time. You want to do whatever is possible to get what you want. But I would say, like Karin said, you have to clean your body. And part of this is the one time that I do insist on compliance with the diet. So usually I will give a list and say, this is, take it or leave it. This is my advice to you. No pressure. I'm not even going to ask you if you do it. This is what's going to be great for you. But when I treat fertility, and I, of course, see how serious they are on what they're willing to do, I do give a very specific list of things that they should not be eating while trying to get pregnant. Mainly foods that will create phlegm in the body, because phlegm, it slows down processes, it gets everything sticky, and things are not moving right. So I basically give them a list of whatever they need, first of all. So whatever their issue is, to balance their body. And in addition, a list of foods, like, for example, dairy or raw food. Everybody thinks raw is amazing, but not for everyone. It depends on the person. That's why it's very holistic. There is a diet that's right for each patient. It's not going to match, because every patient is different. So that's the kind of work we do.
Spoke about it earlier in our podcast. There is no such a thing one treatment for all, and there is no such a thing one diet for all, and there is no such a thing like even practicing gymnastic or gym for all. There is no such a thing, because we're so different. We're different energy, different person, different intake, different what we do over the day, different work, different personality. So there is no such a thing, one thing that fits all, not in colonics, not in any treatment I know, because we treat a person as a person when he comes. So also with colonics, every time it's going to be different session. Same way with acupuncture, and correct me if I'm wrong, every time someone will come, you're gonna start the same on the same area, but you're always gonna add for what you feel today, what your body needs today as far as energy. Because sometimes you can have a stress, like yesterday, and Sharon will see it today, and she needs to open up in order to treat something else. So my question to you is, what's to be safe to say how many treatment a person needs of acupuncture, just to prevent things or feel good, or a routine of is every day, every month? What's your intake for that? What's your suggestion?
Well, it totally depends on the issue that they have. If they have something that just happened, something acute, an issue, an injury, or anything like that, then usually what I do is I'll do 2 sessions for 2 weeks, so 4 total, and then another 2 weeks of 1 session. And usually I would say 95% of the people, whatever issue they had, will go away, because it was just recent. However, if it's a chronic problem, since it took years to get you to the situation that you're in, I'm sure Karin, Karin, I'm sure
we do magic, but you're not going to solve
exactly. So yes,
I'm a magician, but I'm not going to do a magic here. It's like people do expect to solve a problem instant. That's America. They like to drop 50 pounds in 1 minute.
Tomorrow.
Doesn't happen.
Yesterday.
Not even in surgery, people. Not even in surgery. So, yeah, leave the instant. Let's.
Yes, so chronic issues or just to stay healthy. Usually I tell people you're going to be coming in for once a week. For a while, we're going to see after, let's say, 8 treatments, 10 treatments, how you feel. And then my goal is to reduce it to every other week, every 3 weeks, to the point that they need to just come and see me once a month just to keep them balanced. And then, of course, my door is always open if they do have something that just came up. Like a lot of people came post-COVID to go back to their normal health if they had, the long-term symptoms or any kind of other issue that might come up, then they would come for an additional treatment. But usually we reduce it to once a month just to keep them balanced.
Wow.
So yeah, it's kind of like I work. The goal is to see them once a month. So like I mentioned before, insurances do cover acupuncture today, some of them, right, Sharon?
Yes, some of them cover fully, depends, in network, out of network, all that fun.
And real quick, you don't need to have a referral. So, but if they are in your network, if you're in their network, they can just come to you and go, can you help me? And that's really super interesting to know. I've got a question for both of you, Karin and Sharon. Because we were talking like a lot about women, right? The women and infertility and stuff. What about the men? Is it really? So you can help like all that?
Men should create sperm too, right?
Right.
So it works both ways. I mean, we work on the same system. If it's digestive system, if it's fertility, I mean, men have pretty much the same issues too. Maybe he's not going to have the baby, but men can have a problem in his sperm. Men can have a problem with his digestive system. So yeah, it's open up for men. I'm sorry. It does open up for men and women together.
Yeah.
I mean, everybody suffer pretty much the same thing. I mean, and we treat 50-50.
Wow.
The quality of sperm definitely does change. And the stronger the sperm, the better it can swim.
Right.
The better chance it will survive the acidity of the women's system in order to get to where it needs to get. And definitely there's not only acupuncture, but the Chinese herbs that I use a lot of the formulas that are specific to help with that. It's basically, when I told you that I sometimes speak to people in Western terms in order for them to understand what I'm doing to the body. If I try to explain, okay, now we need to raise yin, now we need to move qi, they might not get it. So I say, okay, so this formula helps, increase progesterone. So, for them in their head, that's what they're hearing, even though, it's basically, Chinese. So whatever way we can help a couple get pregnant or just in general make someone feel better, I use all of my tools. People ask me, well, how do you know which help? The acupuncture, the cupping, I don't care. As long as you're feeling better.
Works. That's what I always say. If it works, it works. You don't have to believe it. You don't have to believe in it to happen. It's and there is always, you're gonna hear always people that say, oh, don't go to acupuncture because I heard my grandma says, or don't go to because someone says something. In general, if something works for you, stick to it. Doesn't matter what other people say. And no, I will ask it, is acupuncture is addicting? Because that's a question I get a lot. Is colonic is addicted? No, you can be addicted to everything. Treat your body right, and it really depends on the therapist that treat you. The therapist has responsibility to know and say, okay, enough. let me see you in a month. Let me see you in 2 months. You don't need to come every day or every other day. I mean, us as therapists needs to be also responsible, and that's our responsibility to treat people with kind and and be aware that people that feels good all the time can be addicted to things. But addiction, you can be addicted to go to the gym.
Right.
So
Yeah.
the same way, and I know a lot of trainer that will put so much protein and protein shake and eat so much of, and it's a matter of your therapist telling you what to do, and trust your therapist. That's why I recommend, when you look for acupuncturists, look for referral, check on them, call, ask questions. What's the questions that they should ask to know if acupuncturist is a good one?
Mm.
Well, first of all, I find that my first impression when I check people out is their website. I like going into the website and seeing information. I want them to try to educate me. And when someone calls me, I don't feel, oh, this person, might not become my patient. They will get all of my attention and all the information that I am very happy, willing to give. And a lot of the times I tell them, if I'm not under their insurance, I say, go to the insurance website, find an acupuncturist that under the network in case they can't afford paying cash. And I always say, go into their website, read the reviews of what people say about them. If someone went to and took the effort in writing a review for you, that means you made an impression over their life and you made a change in their health and how they felt. So
Yeah.
for me, if I see someone that has no reviews and their website is basically just describing what they do and how much it costs, or even, no prices, but it's very basic, I feel that they are not trying their best to educate the community onto what the modality that they're offering is how it's going to help them. So for me, it's the amount of time. So it's not about what they say, it's how much they're willing to invest in you, even if they don't know you're going to become a patient or not.
And
Mm.
the other thing, when I already came to you, what is the things that as a client I want to make sure I came to the right place? It's first of all clean needles, like disposable.
That's
No,
a given.
it's very important. You know what? I heard stories, very important, that you see everything. I think,
Mm.
like what your intake, that you see everything up front, right? That you see your tools. You're
Mhm.
not trying to hide anything. That's what I would look for. That everything is clean and sterile, not because of COVID, because
Mhm.
Yeah.
Definitely. Yeah. I loved, COVID. Everybody came, oh, you need to do this, you need to do that. I'm like, I was
I
doing it
used
from
to do
before. I
it all
didn't
the
change
time.
anything. Definitely. The only thing that was different was the mask.
Yeah.
So basically, first of all, for me, it's atmosphere. When you walk in, you want to be relaxed. If you're sitting in a waiting room and there's a lot of people and you go in and out and it's very short and very abrupt, I would never go back to that kind of place. I want to be relaxed. I want to have aromatherapy. I want to really fully let my body sink into it and letting go. And that's one thing that I find that people really appreciate coming into my clinic, that they really get that spa feeling, even though it's not a massage, that they're really letting go of their body and letting the needles do their magic. So, of course, it's very important to see that everything is sterile, everything is cleaned, that the quality of, tools that the acupuncturist is using is very high, and that they feel comfortable in the treatment room and safe. A lot of people feel that they're being, told to just lay down right when they walk in, and
let's
they
go.
don't even check their pulse and look at their tongue. They're not doing a diagnosis, and they just tell them the problem and they just lay them down and stick needles without really knowing what is the issue. How can I balance this person? So, that's part of the quality of treatment, and doing quality over quantity, which is something I chose to do from the beginning. Even from day one, when I had no patients, I said, I would rather spend 2 hours with one patient a day than see four and not really give them all of my best.
True. So
Mm.
let me kind of like date. So the average treatments you recommend between, I want to say, 4 to 10 for prevention, or even start, like to start something to get good result. 4 to 10 treatment will
Yeah,
be
about 6 to 10. Yeah.
6 to 10, and it's covered by some insurances. And there is always ways to work out with your therapist. They can always come, for you, especially if you are serious about getting your treatments, to get some discount in some ways. I'm sure it's possible. And no, it's not painful. And the average session beside the first session will take up to 45 minutes, an
It's
hour.
basically an hour because I never finish a treatment with just needles. We chit chat in the beginning to see what changed, how their body responded to the treatment before that. And I look at their tongue and pulse again because every day is different. And I might feel things that need to be changed, or they might tell me that they have new symptoms coming up. And usually it's when the body feels better, all of a sudden the nervous system can actually feel all the other things that are happening that are eclipsed by the main issue, usually. And then we do the needles about 30 minutes. And sometimes I do cupping, sometimes I do some hands on,
Wow.
sometimes I just
And
sit
this
with
is
them
what
and
I
talk.
wanted to talk about next. But since we can't put everything together in one episode,
Yes.
I'm sure Sharon will be my guest for a lot more episodes, because
Exactly.
there is
Yes,
so
please.
many things we no, because there is so many things that are related to
Yeah.
both of us. And there is so many other treatments, like cupping, like ear coning, like massage, like
Yeah.
gua sha, like so many fields that we touch. And it's amazing how everything goes together, and educate people more and more. But I'm planning on doing Instagram live with Sharon, and
Yes.
we will do a spring cleanse, because
Yes.
everybody needs one. So we will give a lot of tips of what type of food, treatments they can get, um, cleanses they can do, things they can do at home, or
Yes.
use acupuncture or therapists like me. So yes, there is a lot that um, to expect.
Yeah.
I know I don't want to finish it, because there is so much to talk
I
about.
know.
There's so many things that, um, talking serious,
Yeah.
people are just finding out about acupuncture or colonics, even though those methods been here for 6,000 years, but suddenly it become like a Hollywood trend. Well,
Mm.
it's not. It's a really helping method, and I hope we gave a little bit of what is it. But I promise we will do more episode about it. And
Yes.
for all the audience, if you have any question about acupuncture, about what it can do, about what suggestion, feel free to text, or email us. We'll be very happy. Sharon will be happy to answer everything.
Yes.
If you're in the area of LA, Sharon clinic is in LA, is in Agora Hills,
Angora
right?
Hills.
And we will have all her information on our website, right?
Exactly. Yeah.
Yes.
All
People,
of Sharon's links will be in the description if you're listening to this over on Anchor. And when the episode goes up, all of her links will be in the comment section. And
Yes.
if you have questions for Karin, you can email us at, oh, hold on. Yeah, ask Karin podcast at gmail.com.
Yes. Yes. And I before
Shit all the time with you guys.
I know.
I'm
B-
waiting for that hour a week.
before we do wrap up, before we say goodbye, I have to say that you both are absolutely amazing. And again, every it goes without saying, but our body, well, it tells us what we need. We just have to listen to it. And we should have professionals that aren't necessarily, because everybody knows about doctors, but when you look at it holistically, and when it gets back to the foundation of what our body wants to do, I mean, you guys are I wish I was still in Los Angeles.
Hey, you're more than welcome to come.
Oh yeah. Oh yes, soon, very soon. Very soon we will we should oh, yeah. We'll do a lot of
Actually,
stuff.
Sharon can help a lot to your wife.
Yeah.
Benefits so much.
That is what I would love. And we'll get into that, but there's so many uh why does it have to go by so fast? Why does this podcast episode have to go by? But it's all the more reason to have you back on and to do lives, because my mind is blown. Everything you said, I'm just kind of like, oh, my mouth. Just to hear you two talk is absolutely amazing. So thank you, Sharon. Thank
Yes,
you.
this was wonderful.
Thank you.
I
Thank
enjoyed
you,
it as
Sharon.
well.
I love you. And maybe one day we will open that big center.
That would
That's
be
the
awesome.
plan
That's the
eventually.
plan.
Yes. 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 Well, Eric, you want to take us out of this?
Yeah, we just want to thank Sharon again one more time for coming on the show today. And we always want to thank Karin for having a great chat with us. Yeah, like I said, all of the links for everybody will be in the description if you're listening in on Anchor. And like we always say each and every week, everybody, remember, be excellent to each other.